Hello, today we're going to continue our discussion about psychological therapies, beginning with behavior therapy. Behavior therapy applies the principles of learning, classical conditioning, operant conditioning, observational learning, in an effort to help people to change their behavior in various ways. Here on this slide we see a picture of cookies and a glass of milk. And this picture goes along with a famous study that was done and described in your book, where a psychologist taught a little boy who was afraid of rabbits to overcome his fear by associating having a snack with the rabbit until eventually he was able to tolerate even holding the rabbit in his lap without feeling afraid. That famous study was done by Mary Cover Jones, and it describes a kind of behavior therapy that's called counter conditioning, where it is possible to use classical conditioning to evoke new responses to stimuli that trigger unwanted behaviors. One type of counter conditioning is called exposure therapy, and another is called aversive conditioning. In exposure therapy, the therapist introduces the client to a situation about which they experience fear in a gradual kind of way, usually, where either in their imagination or in real life, they are able to tolerate in small steps being in the presence of that situation or object until eventually they can tolerate it without feeling afraid. The video that you will be watching about a young woman who's treated for a snake phobia uses exposure therapy very effectively. One of the early types of exposure therapy still used is called systematic desensitization, although in the video that you'll be watching, they talk about systematic desensitization as a type of approach that they're not using because they feel like the approach that they use in the video, also a kind of exposure therapy, may be even more effective. But in systematic desensitization, you first teach the person how to relax, and then you have them imagine a calm or pleasant scene in which they can feel relaxed. And then in small steps, you introduce in their imagination the situation about which they feel afraid until they can think about it without feeling afraid, and then transition to being in that actual situation without feeling afraid. So it is a method that's used to treat phobias along with other uh, approaches to exposure therapy that have been found to be helpful in the treatment of phobias. Exposure therapy is also used to treat post-traumatic stress disorder and obsessive compulsive disorder as well. A newer development of exposure therapy is the use of a reality exposure, virtual reality exposure therapy, where the person wearing a headset can actually put themselves in the situation through the use of technology that they are afraid of, such as flying, spiders, or public speaking, just as a few examples. And this is also used in helping soldiers who are dealing with post-traumatic stress disorder associated with combat. Another kind of counter conditioning is called aversive conditioning. And here, also using classical conditioning principles, you help the person to associate a stimulus with something unpleasant, like say drinking with becoming nauseated. drinking alcohol, that with becoming nauseated, so that the person may be less likely to drink alcohol. Here we can see an example of that where uh, a drug that causes nausea is the unconditioned stimulus producing the unconditioned response of nausea. Uh, then it's placed in an alcohol drink with the alcohol being a neutral stimulus. It doesn't cause nausea at first, but now when the person drinks with the drug in it, it causes nausea. So they're classically conditioned to feel nauseated when they drink the alcohol. I wouldn't say that this kind of aversion therapy is probably used all that much in the treatment of alcohol use disorder, but it has been used and may still be used at times. When the principles of operant conditioning are used to modify behavior, then we're talking about behavior modification, where desired behavior is reinforced or undesired behavior is punished. When you were in elementary school, you might have been in a classroom where your teacher awarded points for privileges. If that's the case, then your teacher was using a token economy based on the principles of operant conditioning to modify your behavior. So we might think about comparing insight therapies with behavior therapy. Insight therapies include both psychoanalysis and humanistic therapy. So how do they differ from behavior therapies? What would you say? Well, insight therapies attempt to help the patient or client to achieve insight, but in different ways depending upon whether it's psychoanalysis or humanistic therapy, or the modern version of psychoanalysis called psychodynamic therapy. But behavior therapies are not so much focused on insight as they are on modifying behavior through the application of principles of learning from, say, operant conditioning, classical conditioning, or even observational learning can be applied in that way as well. The second question, some unwanted behaviors are learned, so what hope does this fact provide? What would you say? Well, if some unwanted behaviors are learned, perhaps those same behaviors could be unlearned or extinguished, and desirable behaviors could be learned to replace them. Here's another question for you. Exposure therapies and aversive conditioning are applications of what kind of conditioning? Classical conditioning. And token economies are an application of operant conditioning. Another popular therapy that has been found to be effective in the treatment of a variety of problems is called cognitive therapy. And since we already know the word cognitive has to do with the way we think about things, cognitive therapy focuses on helping people to learn more realistic, healthy ways of thinking about themselves and their lives and relationships. Cognitive therapy is based on the idea that thoughts intervene between events and people's emotional reactions to them. In other words, the way we think about something influences how we feel and how we act. We considered this when we discussed depression and how depressed people tend to have a more pessimistic way of thinking about things that tends to make them feel even more depressed. Here's an example of a cognitive perspective. on psychological disorders. Let's say somebody loses their job, and the way they think about it, their internal beliefs are things like, I'm worthless, I'm hopeless, leading to depression. But what if a person lost their job and they could think in a different way, perhaps a more helpful and realistic way? It wasn't a good fit, I deserve something better. Then they may be less likely to become depressed over their situation. We're not saying that it's necessarily easy to think in a different way, but that it can be helpful to think in a different way. And cognitive therapists help clients to look at some alternative ways of thinking about their situation that might be more realistic, more helpful, and lead to better outcomes for them. One person who developed cognitive therapy for depression is Aaron Beck. He's well known for his work in this area, and he developed a type of therapy where he helped clients to see how their thinking was irrational in various ways, and then to learn how to reverse these negative views of themselves, their situations, and their futures, so they could think in more realistic ways. And he went about this by gently asking them questions to help bring out into the open possible distorted ways in which they were thinking, and then challenge them to consider some other ways that they might be able to look at themselves and their situation. An example of this would be how we tend to sometimes catastrophize or blow things out of proportion and make them a lot worse than they are. And when we do this, we also tend to blame ourselves uh, and to think it's never going to get better. It's always going to be this way. And we see this in the pessimistic kind of way of thinking that we were referring to earlier that is associated with depression. Cognitive therapy has been found to be helpful in the treatment of a variety of other problems as well, including anxiety disorders and others. Sometimes cognitive therapy and behavior therapy are combined, making cognitive behavioral therapy. And this is sort of, the best of the two worlds of cognitive therapy and behavior therapy, where you bring them together, helping people to learn how to modify their thinking as well as their behavior. When you combine more than one type of therapy, in an approach, that's called integrative therapy, because you're integrating at least two different approaches. In this case, it would be cognitive therapy and behavior therapy. Cognitive behavior therapy is a very popular approach to therapy and has been found to help people uh, with a variety of different problems. A type of cognitive behavior therapy called dialectical behavior therapy was developed by Marcia Linehan in an effort to help clients with uh, problems in areas like uh, self-destructive behaviors, suicidal behavior, and different kinds of impulsive behavior, where they might repeatedly end up doing things that were harmful to themselves and perhaps even other people, helping individuals who have problems with self-regulation of their emotions and their behavior. One particular psychological disorder for which this approach has been used is called borderline personality disorder, and it has been found to be very helpful. It combines cognitive approaches with social skills training, where individuals learn more effective coping techniques, and mindfulness meditation, where they learn how to regulate what's going on inside their mind and their body better, including how to calm themselves down and engage in better emotional self-regulation skills. So how do humanistic and cognitive therapies differ? What would you say? Well, they are similar in some ways in that they focus more on conscious than unconscious processes, but cognitive therapies tend to be more directive than non-directive, and they're focused more directly on the way people think and helping them to work on changing their thinking in ways that can result in a more realistic way of thinking about themselves, their lives, and their future. What is cognitive behavioral therapy, and what sorts of problems does this therapy best address? Well, as we discussed, it is a kind of integrative therapy where you combine cognitive and behavioral approaches, and it has been found to be helpful with a variety of problems, including depression, anxiety, and some others. The last type of psychological therapy that we'll take a look at is when more than one client is involved in the treatment. That includes group therapy, where clients might get together in a group with a therapist or two co-therapists and uh, work on the problems or concerns that they're having and work on being able to make positive changes in the way they think and feel about themselves in their life and in their relationships. Uh, One of the advantages of group therapy is that you find out you're not alone, that there are other people who have concerns and problems too, sometimes similar to yours. Another advantage is that it can help you gain hope because you can see other people who are making progress and they're working on their areas of concern, and it can give you hope that you might be able to get to a better place as well. In addition, you're able to get feedback not only from your therapist but from other members of the group on what you're working on in your life, and you can also try out new behaviors in the safety of the group that you might be able to then practice outside of the group in your everyday life and in your relationships. Sometimes the focus is the whole family or maybe a married couple where you're able to work not as much on individual issues as on relationships, how you communicate with one another, and working on helping your marriage or your family to get to a better place where there's less conflict, more effective communication, and support within the family. Well, here's a question for you. Which therapeutic technique focuses more on the present and future than the past and involves unconditional positive regard and active listening? That would be humanistic psychotherapy. Which of the following is not a benefit of group therapy? More focused attention from the therapist, less expensive, social feedback, reassurance that others share troubles. More focused attention from the therapist is not a benefit of group therapy. That would be a benefit of individual therapy because, of course, in group therapy, the therapist is giving attention to all members of the group. Another important question that's asked in this chapter is this question: is psychotherapy effective? The short answer to that question is yes, it is effective. There have been hundreds and hundreds of studies done on psychotherapy looking at its effectiveness. Generally speaking, it's effective. It's effective in the treatment of various kinds of problems. Perhaps some types of therapy may be more effective than others in the treatments of various kinds of problems. And there are certain characteristics that are a part of psychotherapy relationships, regardless of the orientation of the therapist, that also seem to make a difference. But in this graph, we see the results of a study where they examined the results of many other studies. That's called a meta-analysis. And they found that the average psychotherapy client was better off than 80% of untreated people. In other words, 80% of untreated people have poorer outcomes than the average treated person. So overall, we would say that psychotherapy is effective. Some people do not benefit from psychotherapy and may even get worse, but most people do benefit, and oftentimes they benefit a lot. If you were a psychotherapist or counselor and you were working with somebody who was not getting better or was getting worse, you would have an ethical responsibility to discuss that with your client and to figure out what to do about it. Perhaps changing your approach, getting a consultation with a different therapist, or referring them to a different therapist, but you wouldn't want to continue working with somebody if they weren't benefiting from the therapy. It has been found that some types of therapy tend to work better for some types of problems than other types of therapy. And this is one of the things that's encouraging about psychotherapy, is that there are a variety of different types that have been carefully studied and found to be helpful. There are other types of therapy that haven't been studied to know whether they're helpful or not. So if I were seeing a therapist, I would rather work with a therapist who knows a lot about the types of therapy that have been found to be helpful, so they could take one of those approaches or an integrated approach with me. Behavioral conditioning therapies, for example, have been found to be helpful with problems like bedwetting, phobias, compulsions, marital problems, sexual dysfunctions. Psychodynamic therapy has been found to be helpful with depression and anxiety. Cognitive and cognitive behavioral therapies have been found to be helpful with anxiety, depression, and PTSD. And non-directive, person-centered counseling, which is a humanistic approach to psychotherapy, has been found to be helpful with mild to moderate depression. That doesn't mean that some of these types of therapy might not be helpful with other problems too. It's just that these are problems that research studies have demonstrated effectiveness with these particular kind of therapies and the problems that are listed here. A way of approaching therapy nowadays that many clinicians embrace is what's called evidence-based clinical decision-making. Evidence-based clinical decision-making takes into consideration the particular patient's values, characteristics, preferences, and circumstances. In other words, what's important to them? What kind of culture do they come from? What kind of approach makes sense to them that they might have confidence in trying? The second sort of leg of the stool, if you will, is the clinical expertise of the clinician. Like, how knowledgeable and skilled are they? And the third leg is, what does the best available research evidence suggest about a particular type of therapy being applied to a particular problem, and how knowledgeable and skilled then is the therapist in using that approach, and is it one that the client can relate to and have some confidence and hope that it might be helpful to them. So therapy is most likely to be helpful for those with problems that are or are not well defined. Well defined. And what is evidence-based practice? Practice that's based on the best knowledge, based on research, of different types of therapy and their application to helping people with specific kinds of problems. Regardless of the particular type of therapy that's practiced, psychotherapy in general has been found to be beneficial for these three reasons. Psychotherapy provides hope for demoralized people. It provides a new perspective on oneself and the world, and it provides an empathic, trusting, and caring relationship. All three of these benefits have been found to be really important in influencing the outcome of psychotherapy with individuals. A therapist hopefully has hope that their work with their client is going to make a difference in their client's life, and they are able to communicate that hope in the way they relate to their client. A lot of times when we're struggling with something in life, it's like we have blinders on and we can only see things in one way. So another benefit of therapy is that therapists can help us to gain a new perspective on ourselves and the world. What might be another way you could look at that or think about that? Might be a question that a therapist might ask a client. And then a therapy relationship is unlike any other relationship we might ever experience, because when else would you go see a perfect stranger and give them the benefit of the doubt by trusting them and opening up and sharing with them really personal things about yourself, oftentimes from the very first meeting? And when else would you be in a relationship where the focus is just on you? You're not there to talk about the therapist and their challenges in life if you're a client. You're there to talk about and focus on yourself, and it's the therapist's job to help you and to do whatever they can to be mindful of your well-being and to help you in whatever way they're able to in the context of their relationship with you. Here's a list of some common kinds of problems that people might have when they seek counseling or psychotherapy: feeling hopeless, being depressed, engaging in self-destructive behavior like substance abuse, having fears that disrupt their lives, sudden shifts in mood, thoughts of suicide, compulsive rituals like hand washing, sexual difficulties, hearing voices or seeing things that others do not experience. These are just some of the reasons why a person might seek counseling or psychotherapy. And sometimes we might seek the help of a therapist or counselor not because we're having a significant psychological problem, but just because we just want somebody who can listen and maybe help us sort some things out in our lives where we don't necessarily have to have uh, significant psychological symptoms in order to go see somebody. So you might wonder about what kinds of professionals do counseling or therapy. And here's a list, not a complete list, but a list that you'll find in your textbook of some of the different professionals who do psychotherapy or counseling. Clinical psychologists and another kind of psychologist called counseling psychologists do therapy, as do psychiatrists who are medical doctors who have specialized training in psychiatry. They do residency on that in that. A clinical or psychiatric social workers and licensed professional counselors are some of the folks who do counseling or therapy. So do chaplains, and also marriage and family therapists are a couple of others who do counseling or therapy. It's good to find out about the credentials of a person that you would work with in counseling or therapy and get a feel for them as a person and the way they approach their work so that you can feel confident in them and can develop a trusting relationship with them. I hope that gaining a better understanding of psychological therapies and the people who practice them may help you to be perhaps more likely to ask for help if you need it one day, or to encourage somebody that you know and care about to take that step. That completes this section of our discussion. The last topic that we'll be discussing in this chapter is biological therapies, and that'll be coming up next. But thank you, and peace be with you.